Hi, my name is Dr. George Loukatos and I'm with AlphaCare Urgent Care. Today we're going to talk about cold and flu season. The cooler weather is forcing people inside, and with that we're starting to spread germs amongst each other. So as a clinician, when you get sick, things that I'm looking for are, do you have a virus or do you have a bacterial infection? And people often ask me, well, what is the difference? When do I need an antibiotic versus when do I just need medications to help? One thing that in general I look for is what kind of symptoms are you having? That can give me a clue as to what you need and whether you have a viral or a bacterial infection. If you have a lot of different symptoms like headache, sore throat, nausea, constellation of different things, that tends to be viral, whereas bacterial infections tend to be more of one symptom, like I have a really bad sore throat or my sinuses are really hurting me. Another thing that guides clinicians is, of course, testing. We have rapid tests that can help us determine if you have COVID or the flu, things like that, and we get results within 10 or 15 minutes. And then we have other things like cultures that take longer to come back but can give us more specific answers as to what is causing your illness. At the end of the day, the reason we're looking for a specific cause is because all these things are treated differently. For example, if you have the flu, you need Tamiflu, whereas if you have COVID, you might need symptomatic treatment. Or if you have a bacterial sinus infection, then you need an antibiotic. And why is it important that we get the right treatment? Well, because these medicines are not without side effects. People always think, well, I need an antibiotic. Well, if you have a viral infection, an antibiotic may just give you diarrhea or a woman yeast infection, and so we really don't want to give antibiotics unless they're absolutely necessary. The other reason for that is, if you see too many antibiotics during your lifetime, when you actually need one, you may develop resistance within your body to it and it may be ineffective. So if you're feeling ill, you should come in and see us. You can see one of our trained providers that can do the proper testing and a thorough exam on you and determine what you really need to get you back and feeling better. This is Dr. George Loukatos with AlphaCare Urgent Care. Thanks for tuning in.